We're going to go through the process of a physical exam. These are the steps that I would take as the vet when I come out to examine your horse. And some of these things require a little bit of extra equipment, but we'll go through some of the ways that you can do this on your own if you don't have a stethoscope handy. So first and foremost, I want to get an idea of the horse's, behavior, their mentation. Are we happy? Are we alert? Are we oriented to the environment? Are we standing squarely on all 4 feet? Are we resting a limb, showing signs of obvious pain? Do we look dull in the eyes? Things like that. So starting at the front end, I can see that Scarlett is very interested in what's going on here. She looks bright, she looks happy, and she's standing comfortably. So I'm going to do kind of a nose to tail evaluation. I want to take a peek at her gums. Does she look pink? Does she look moist? And see, do we have any evidence of discharge from her eyes, from her nose? Does she seem well hydrated? And she does. So I'm going to move along and do a little skin pinch. This can give us a basic idea of hydration status. I would say don't read too heavily into it, especially if your horse is older, because as we all know, as we get older, we start to lose some collagen under our skin, so things get a little bit wrinkly and might not pop back into place the way that they once did. So if you have a stethoscope, pop it on and take a listen for her heart right behind the elbow here, where your girth would sit. Sometimes you have to wiggle it around a little bit to really get a good listen. A heart rate on average in an adult horse is in the ballpark of about 28 to 40. And I'm checking that there's no murmurs or no abnormal rhythms. If her heart rate is too high, that can be an indication that she's in some amount of distress, that she's in pain, she might be uncomfortable, or she might just be a little bit worked up. Working my way back, and again with my stethoscope, I want to take a listen for her lungs. So the lungs actually occupy a really large portion of their thoracic cavity, and they fill up about this much space. So I want to listen through all areas of the lungs to see if we have any abnormal crackles, wheezes, things like that that might indicate disease or asthma, things that I'd want to be worried about. At rest, an average adult horse usually has a respiratory rate between 8 and about 20 per minute, depending on how hot it is outside, have they been doing any work, that sort of thing. And because a horse is so big, their lungs are usually fairly quiet normally. So if I'm not hearing anything significant, that's generally a good sign. So while I'm listening with my stethoscope, I tend to just move on back. And I'm going to listen for her gut sounds. I'm going to listen high up and down low. It should sound a little bit like a percolator. We can hear little gas pings, sometimes some fluid gurgles. The main thing is that I want to be hearing something. Because we know in horses, colic can be a pretty serious condition. So if we hear no gut sounds at all, that's usually an indication that things aren't moving the way that we want them to. Then while I'm back here, I'm going to safely take her temperature, standing to the side so that I don't get myself in harm's way. And in an adult horse, we consider normal temperature up to 101.5 Fahrenheit. It's relatively normal for it to be lower in the morning when they haven't really been moving around yet, and it tends to creep up a little bit throughout the day. So Scarlett's at 99.2, which I would consider completely normal. So now that I'm happy with her temperature, her pulse, her respiration, we have good gut sounds, I'm going to palpate her feet and her digital pulses. That gives us an idea if there's any sort of inflammation going on in the foot, a condition like a foot abscess or a laminitis. I would expect both of those things to be elevated. So this can be a little bit tricky in a horse that doesn't have an abnormality. They can be a little bit hard to feel, which is normal. That's a good thing. But I'm going to come down and feel just at the back of her fetlock here. You can actually see where the vessel is. And I'm going to just lightly squeeze with my fingers and my thumb to see what I feel. If it feels like it's bounding, like the pulse is exceptionally strong, that's an indication that there's inflammation going on down low. You can actually get an idea of the temperature of her legs and her feet and make sure that they're consistent from side to side. Anything that feels abnormally hot or abnormally cold is usually an indication that something's going on somewhere. if you don't have a stethoscope. There's other ways that you can take your horse's vital signs. If you feel under your horse's chin, right inside the mandible here, right inside the jaw, if you take a couple fingers, you should be able to feel a pulse in their facial artery. It can be a little bit tricky, and because horses have a slow heart rate, sometimes it takes a little while to find it and to count. But without a stethoscope, this is probably the easiest way to get their heart rate. And if I'm trying to measure respirations, I can put my hand on and feel and just watch for her abdomen rising and falling so that I can get an idea of what her respiratory rate is. And even without a stethoscope, in most adult horses, if they're having normal GI sounds, you can usually get a listen as to what's going on there. So that's your basic physical exam. This is the process that I, as your vet, am going to go through when I come out to evaluate your horse for pretty much any reason. If it's a routine wellness exam, if we're worried about colic, if we're worried about any sort of medical condition, I need to know this information. And it's good to know how to perform these on your own so that when you do have a call into the vet, you can provide answers as far as what is my horse's heart rate today? What is their respiratory rate? Do I have a fever? These are all important things for us to know when we're trying to figure out how best to help your horse.